Okay, good afternoon, everybody. It's about that time, 2:15 on Tuesday, May 12th. And welcome to the City of Grand Forks Virtual News Conference. As we have in the past, we'll hear from our panelists. And then once they are done, we'll leave it open for a Q&A. Media members can use the raise hand feature within the Zoom webinar to be called on for the Q&A. And as we start all these, we'll start with Mayor Brown.
Thank you, John. So the Grand Forks Virtual News Conference, the City of Grand Forks, Tuesday, May 12, 2020, will have panelists Dr. Joshua Deere, Director of Primary Care, All True Health System, Dana Sandy, City of Grand Forks City Council President, and Barry Wilford, President and CEO of the Grand Forks East Grand Forks Chamber. So I want to say today, thank you, all of you, for joining us and staying informed. Make sure you continue to follow reliable sources for your information. And you can find links of reputable sources like the North Dakota Department of Health, Grand Forks Health Department, and the CDC at our website. There's a lot of misinformation floating around, and having an informed public is important as we move forward. Today, we're going to talk about the public health numbers and then talk in detail on the Grand Forks Smart Restart. Let's start with the most recent numbers. The North Dakota Department of Health and private labs are reporting 59 tests completed today for COVID-19, with 5 new positive cases in Grand Forks County, bringing the countywide total to 293. State and private labs have reported 4,552 total tests conducted in Grand Forks County. 195 Grand Forks County patients are recovered and 98 are still active and being monitored. With that, I will send to Dr. Deere and then continue with the discussion of our GF Smart Restart. Dr. Deere.
Thank you again, Mayor, panelists, and media for this opportunity to connect with our community. As we continue to focus on the safe restart of our community, I want to remind our patients to visit Altru for your regular care. We have many safe protocols in place and are here to care for you. As of this morning, Altru has 9 patients in the inpatient setting with COVID-19. The demand for testing has remained fairly steady with around 80 per day. We have a total of 653 tests available for community testing. While demand has decreased, we remain open and are ready to help with all healthcare needs safely. Our testing capabilities have remained steady and consistent from a community perspective. We're thankful for the partnerships with our state that has allowed us to maintain comfortable swab kit supply based on guidelines. I'd also like to thank UND for their collaboration on rapid testing for our inpatient population. These tests ensure that hospital patients are tested quickly and can be cared for appropriately. Thanks again for the opportunity to participate in this panel. Now I'll send it back to Mayor Brown to discuss the Smart Restart.
Thank you, Dr. Deere. So far, fighting this pandemic has been federally supported, state managed, and locally executed. And we thank our congressional delegation of Senator Hoeven, Senator Kramer, and Representative Armstrong, Governor Burgum and his administration, and our local organizations for their collaborative partnership over the past few months. We expect more policy decisions to shift to local governments as the impacts of the virus become more regional. That's why I have formed the Mayor's Economic Response Advisory Group to advise me on issues related to our local response, the economic recovery, and to provide their insights to other decision makers throughout the community. They have worked up a framework for local action that focuses on 3 key areas. Public health. How do we maximize citizen safety? This is the highest priority. Economy. How do we minimize the impact on the local economy? City government. What is our role? What actions should we take? The framework identifies issues and potential actions in the areas of public health, city government operations, healthcare, information and communication, education and workforce, impacts on hospitality, retail, and events organizations, the primary economy sector, real estate and construction, and social impacts. Some actions will include, but not limited to, the creation and sharing of data for public policy decision-making in centralized data dashboards, which could include employment rates, case numbers, sales tax revenues, and potential serology testing. Next, continuing to assess and adapt local regulation to allow new business models for the hospitality and retail industries. We have done this throughout the pandemic through the emergency orders I have enacted. We will continue to examine and adapt to market needs and trends. Another action item will be to convene and continue the work of the Team Grand Forks efforts to communicate local funding needs to federal and state governments, as well as work closely with our institutional partners like UND, Altru, and the Grand Forks Air Force Base. When our institutional partners are strong, Grand Forks is strong. In fact, Team Grand Forks just met today, and I also continue to have recurring meetings with our institutional partners. I sent 2 letters to our congressional delegation supporting CARES Act funding and communicating our specific local needs. We have been working closely with the North Dakota Department of Health and the North Dakota Department of Commerce throughout the past few months, and they have expressed how Grand Forks has been the forefront on these efforts. Grand Forks has always worked well with our federal, state, and local partners, and we will continue that moving forward. One thing I've been proud of during my administration is the good working relationship we have had with the City Council. As a legislative and policy-making body, the leadership of the City Council has been actively involved in business listening sessions and has participated in my Economic Response Advisory Group. I'm happy to have City Council President Dana Sandy on the panel today to talk about his perspectives, because the City Council will have a lot of important policy discussions in the months to come. I look forward to working with the Council President and the rest of the Council on these topics. Another advisor on my Economic Response Advisory Group is Chamber President and CEO Barry Wilford. We're excited to have him here today as well to talk about our GF Smart Restart from a business perspective and what he sees as the keys to success and significant challenges ahead. High contact businesses like bars, restaurants, fitness centers, barbershops, and nail salons have opened up with the standards and guidelines enacted by the state. A reminder that opening your business is voluntary, not mandatory. The state standards and guidelines are available on the city's website, and we encourage you to closely examine them if you plan to open your business in the near future. I want to empower all of our citizens to please let management of our businesses know if there are ways they can improve their reopening practices so that we can all have a successful and safe, smart restart. We also have signage on our website that helps communicate your care and concern for your health and safety of your employees and customers. We appreciate the seriousness of our local business community that's demonstrated in the implementation of these measures, and we want to thank everyone for doing their part for our Grand Forks Smart Restart. Consumer confidence is essential. The citizens of Grand Forks want to support their local businesses, but they also need to feel safe when doing so. When people are healthy and feel safe, the economy will rebound. We've seen our business community be innovative and expand their business models, and we encourage everyone to support local businesses in ways that make them feel safe, like curbside pickup, delivery, takeout, and on-site. What is our goal? Bring back what makes this place, Grand Forks, special. To do this, we need to focus on health and bring back businesses and jobs, but with safe and sustainable measures in place. If we do this right, we can look forward to regaining the best parts of who we are as a community, like farmers markets downtown, outdoor festivals, UND football at the Alaris, and oh yes, UND hockey at the Ralph. These should be our goals, and we need to do things right now, like physical distancing, following CDC guidelines, wearing face coverings in public settings, and slowing the spread to get to these goals. Now we'll hear from Council President Dana Sandy. Welcome.
Hey, thank you, Mayor. That was exceptional, great information. I must reiterate your comments. I believe the City Council and the Mayor have had a great working relationship for the last 10 years of my time on the council. And it truly has been a pleasure of mine to serve the citizens of Grand Forks. And the relationship that the council and the mayor have had has been based upon compromise and concern for the citizens of Grand Forks. And that starts with your leadership. You know, you have been very concerned about the health and welfare of the Grand Forks citizens. Because of that, once the initial emergency response process was initiated through public health, you started the discussion related to the future economic recovery of the city of Grand Forks. That discussion that you started, Mayor, led you to convene an economic advisory group comprised of elected leadership, business leaders, and healthcare executives. The group has been asked to help review data, weigh options, and provide you and Grand Forks business owners with advice related to economic recovery from the viewpoint of the local government, public health, and with the regional economy in mind. This group, of which I'm a part of, has been used many assumptions to guide the response of the group, including the fact that policy and decision-making must balance public safety with the local economic impact, And certainly the bold assumption, and an assumption that I believe is true, that the financial burden of our local economic recovery is likely to fall upon the city of Grand Forks and thus its taxpayers, rather than the federal or state of North Dakota governments. There are several potential areas of action for the city of Grand Forks. Similar to when the business listening sessions that we've had ultimately led you, Mayor, to execute your executive order to allow restaurants to sell and deliver alcoholic beverages. I believe the Economic Advisory Group will bring concepts to the mayor and the city council over the next few months for discussion and potential long-term policy recommendations. You, Mayor, and the City Council will need to work together regarding these long-term policy changes, and certainly implementation of any of the recommendations will take time and will need to be thoroughly vetted by multiple organizations, including the Chamber. I would like to say a special thank you to you, Mayor, for your leadership related to our economic recovery. And of course, thank you to both Councilman Weber and Veen for helping lead the discussions of the Economic Advisory Group. Thank you, Mayor.
Thank you. I found those listening sessions to be quite informative. And now, Mr. Wilford, President and CEO of the Grand Forks Chamber. Mr. Wilford. You're muted, sir.
Thank you, Mayor Brown, for including me in today's news conference. I'm very proud of how the Grand Forks business community has responded during this pandemic. Like everyone else, businesses have continued to adapt to the emerging guidelines provided by the CDC and state and local health departments. The financial impacts to local businesses have been widespread. Most businesses have been negatively impacted, particularly hospitality, restaurants, personal service businesses, and entertainment venues. Many businesses have adapted and have moved to virtual offices. A handful have actually seen an uptick in business, but most have been adversely impacted. I think I can speak for every business when I say thank you to all of our dedicated and loyal employees who have helped keep critical services and businesses open to the extent possible. Also, thank you to all of our customers for supporting the local business community. I can't overstate how much local businesses appreciate your support. Looking ahead, I think something that surprised many of us was on May 1st, when the North Dakota governor's Smart Restart went into effect. Not every business was in this huge rush to open on May 1st. Businesses took a very cautious approach and are still taking a cautious approach to make sure guidelines were in place and protocols were ready to be followed to ensure that their employees and customers were safe. Safety is on every business person's mind. I'd like to thank the governor's team, the Department of Health, and the CDC for having guidelines readily available for the business community. Also, thank you to the Northwest Minnesota residents and North Dakotans for taking personal responsibility and using common sense during this pandemic. That's no surprise to someone who's lived in this region his whole life. It was interesting in a conversation last week with Minnesota Governor Walz as part of a Minnesota Chamber meeting, that he was very interested in knowing how the opening went in North Dakota. We talked about how cautious businesses have been. They've been self-regulating. We also sort of joked it's kind of an arms race between businesses to see who can make their customers feel safest and actually be safest. The governor noted it's really evidence that free enterprise works. From a business perspective, self-regulation and customer service is always better than a one-size-fits-all set of rules. Again, I want to thank all of the employees of the Grand Forks business community for keeping us open, and also to all of our customers for shopping local. Thanks, Mayor Brown, for your leadership in this time of crisis, and we look forward to participating with you in your Smart Restart for Grand Forks.
Thank you, Barry. We're very fortunate to have an active chamber as we move forward to our economic recovery. And next we go to our question and answer portion. And on the panel today, we'll add Todd Phelan, City Administrator, and Debbie Swanson, Director of Grand Forks Public Health. John?
Thank you, Mayor. To the members of the media, again, please use the hand raise feature to let me know that you have a question and to call on you. And our first question this afternoon comes from Mr. Neil Carlson from iNews. Go ahead, Neil.
I guess this question is for Debbie Swanson. The Douglas Place Treatment Addiction Center in East Grand Forks, now the Minnesota Department of Health has confirmed at least 6 cases. An employee says there's 7 in staff, and the employee says none of their around 65 residents have been tested. And also 7 of those employees live on either side of the river, North Dakota and Minnesota, plus those residents also are free to walk out of that place. And she says many of them go to the Mission. Some just walk out. They're tired of treatment. I'm just wondering, have you had any connection with the state at all on what's being done or being tracked as far as Douglas Place?
Hi, Neil. This is Debbie Swanson. I'll take your question. We are aware of this situation. We were aware that there were approximately 6 staff members that have tested positive. Our concern is when we have individuals that work across borders and across care environments to make sure that all residents in those facilities are protected. This particular situation has been discussed between Grand Forks Public Health Department, Polk County Public Health, the North Dakota Department of Health, and the Minnesota Department of Health. And the facility is regulated by the Minnesota Department of Human Services. So I think there's plenty of people that are aware, and it definitely does need attention. I will tell you that we are concerned, especially if individuals should leave the facility and seek care in a shelter in Grand Forks County. We would definitely want to know that and want to ensure that those individuals are offered testing and isolation or quarantine, whichever is warranted.
Thank you, Deb. Next question coming from Chris Larson from The Flag. Go ahead, Chris. Sorry about that, Chris. My fault. Go ahead.
You got me there, John?
I got you, Chris. Go ahead.
Question is for Mayor Brown. I've had a couple of questions, and hopefully you know the answer to this. Any idea when the Grand Forks Library is going to reopen?
No, but I know that the director of the library is working on sanitation and spacing and things like that as it comes forward. So I would expect an answer very soon. People are very anxious to get that library back. I understand.
Okay, next question from KNOX.
Question for Dr. Deer. Dr. Deer, in your opening statement, you mentioned today that the demand for tests have decreased. Can you tell me what kind of trend and over what time that looks like as far as the demand for tests being decreased? And then does that mean that less people are reporting the symptoms that it takes to get tested?
Yeah, I'd say that over the last week to 10 days, we've seen a decrease in need for our sick clinic, honestly. This past weekend, we saw 2 total patients as we're open for service on the weekends with that service. We continue our curbside testing. We're going to continue to look in our community for COVID and anything that meets North Dakota Department of Health guidelines for testing, we're going to continue to test.
Thank you, Dr. Deer. Our next question is actually from online on Facebook, and it's for Dr. Deer as well. Dr. Deer, can you go through the process that it would take from a patient, what they need to do if they feel they have symptoms in order to get a test? It's more than just walking into the hospital, correct?
Yeah, first step, which you've heard from Minnesota Department of Health, North Dakota Department of Health, CDC, is contacting your provider via phone or however you contact your provider. At Altru, we've developed the COVID hotline, which we've talked about many times on this forum, 780-6358, or using our website. From there, we have a 24-hour service line that's dedicated to answering questions for patients, and we'll get you to the right spot for testing if you qualify.
Thank you, Dr. Deer. And next question, Mr. Neil Carlson.
I don't know, whoever wants to tackle it. Since the bars and restaurants have reopened, when would you expect to see a spike in cases if that's going to happen?
Well, I would suspect due to the incubation period from 4 to 14 days, I would expect in the next 2 weeks, if we're going to see an uptick, we would see it in that time. And then I would expect the hospital to express their concerns to me if we need to take local action to curb that spread.
Thank you, Mayor Brown. A follow-up, Dr. Deer, to you regarding the testing. What are the criteria for testing at this point? I know that is a bit of a moving target.
Yeah, it's fever, cough, or shortness of breath, or a constellation of 2 symptoms that are, it's quite a lengthy list that I'm not going to go over, but it's on the North Dakota Department of Health website. Also, if you're in close contact with patients, someone from Debbie's office states that you're in their tracings, they notify you, you may not have any symptoms and get tested. So those are the ways that people end up getting tests.
Thank you, Dr. Deer. Next question, Mr. Chris Larson. Go ahead, Chris.
My question is for Barry. Barry, what are you hearing most from businesses about concerns coming out of this restart? Are you hearing anything that's similar across the board?
I think the underlying thing is, how do we make our customers confident that they're going to be safe when they shop and do business in our stores? And also, how do we keep our employees safe? Those are the 2 real themes that I'm hearing. And I think that's why you saw kind of the hesitancy. Not a lot of businesses actually opened right away on May 1st when they could, the ones that were closed. They wanted to have those different protocols in place to keep people safe. So I guess kudos to the business community for really going out of their way to make their customers feel safe and their employees be safe.
Thank you, Barry. Next question from KNOX. Go ahead, Ryan.
Follow up for Dr. Deer regarding the incubation period that the question was asked about when you might see a spike as far as the reopenings happening. So the incubation period, according to the CDC, 2 to 14 days. This is day 12, I believe, of the reopen. We opened on May 1st. So we would begin to see that number ticking up already, would we not? I mean, at some point, 2 to 14 days. They don't all come in at 14 days. Some of them would come in day 8, day 9, day 10. That's a logical conclusion, is it not?
Yeah, I do think that that's a logical conclusion. We also felt that after the LM spike, where we had large community spread, that we'd see a large increase. We saw an increase, but not one that we had all expected. It argues that we've been pretty smart as a community, honestly. Our business have done a good job. Our citizens have done a fairly good job, and our health system's doing a good job. So I think the constellation of all that lined up together has hopefully flattened the curve, so to speak, and we're seeing our cases come in at a much more manageable rate.
Thank you, Dr. Deer. Mr. Neil Carlson.
I guess maybe for Debbie or Dr. Deer again, what's happening in Cass County, if they stay on the same track, they're going to hit 1,000 cases here very soon. Has it been looked at what's happening in Cass County? Is that at all connected to Grand Forks between people traveling back and forth? There are actually quite a few people who do that work in either city.
I would default this one to, I'm not sure, to Deb Swanson as far as any connection, maybe working with the state health department. Go ahead, Deb.
I'll be happy to try to answer that question. I won't guess about what might be happening between our communities because I don't think we have a really good way to measure that unless we have known contacts and cases. But what we do know is in the Cass County area as well as Clay County area, there were workers that worked in more than one facility between the 2 counties, and it tends to be in long-term care where a lot of their cases are. The Centers for Disease Control had a team here in North Dakota, and they looked at it and they made some recommendations to the North Dakota Department of Health regarding that. And I do believe they're putting many of those things into place with much more robust testing in that environment. We are also testing long-term care here in Grand Forks County as well. I believe this week we will have completed all of them, and some are starting a second round of testing among their residents and their workers as well. That's a vulnerable population that we absolutely want to protect. Our cases did happen to spike with a particular industry, and we don't know necessarily the source of that, but we believe with a closure and contact tracing, that's been largely contained. But I think the public needs to understand that this virus is here with us for a while, and our goal is to simply contain it as best we can and mitigate it, but it will not simply go away, and we will continue to see cases just as we do with other diseases that can occur in the population.
Thank you, Deb. Next question, Mr. Chris Larson from the Flag.
Question for Dana Sandy. Dana, obviously this North Dakota Smart Restart is not only a cooperation of your city leaders, but your community as well. Can you talk a little bit about how the community members have made this be as successful as it is to this point?
Hey, that's a great question, Chris. I think it's been led by the business owners. The business owners have been taking the opportunity, and I think Barry would already touched on this. The business owners are being smart about the way they open their businesses, providing a safe environment, or as safe an environment as they think necessary to support the customers that will visit them. And that is providing a confidence level to the consumers in Grand Forks to allow them to feel good about going out and whether it's going to a bar or going to a restaurant, hitting a local retail store. So I think it starts with the business owners. They're being smart. Our chamber, of course, has been doing a very good job of getting information out to the business owners to make sure that they understand where to go for information from the state, CDC guidelines, those sorts of things. So it started with the business owners. That's translated into some level of consumer confidence, which is better today than it was last week, than it was the week before that. And so I think that will continue to increase as we get used to having businesses continue to be open and the number of businesses growing that are open within our community.
Thank you, Dana. Looking for another question from the media. If not, I'll just wait 1 second for a hand raise. Looks like we're good. Thank you for the questions from the media. That was wonderful. And we will end, as we always have, with Mayor Brown.
This will be a marathon, not a sprint. Grand Forks has always been resilient, and we need to work together to overcome this. As they say, if you want to go fast, go alone. If you want to go far, go with a team. Grand Forks will overcome this. We will go far, and we will go as a team together. Stay vigilant, stay cautious, slow the spread, and save lives. We're in this together. We'll get through this together, and together we'll emerge stronger. Thank you.
Thank you, Mayor, and thank you everyone for joining us this afternoon. Have a good Tuesday. Goodbye.